I'm Cindy, the physiotherapist. I usually kickstart my day with a cup of coffee, and then I'll go back to the clinic and then I'll start looking through the patients for the day. So the patients that I see typically comes in with acute or chronic musculoskeletal issues where they may be complaining of pain in the bones, muscles or nerves. And I also treat patients who come in with sports injuries or even post-op cases.
Hi, good morning. I'm Kelvin, the Podiatrist. Just sent my son to my parents. I'm here for work, so I'm going to start the day by checking the Ask a Podiatrist WhatsApp first. So each of our patients come in with their individual unique condition. We will try to get as much information from them as possible and do a thorough assessment, do a bit of detective work before we arrive and an accurate diagnosis. From then on, we then come up with an appropriate management plan for them. Hi, Keen. How can I help you today?
Oh, I have this issue with the bum here.
Mm.
Yeah, so it's when I walk, it's quite painful.
Sure. So what we need to do today is to have a look at you walking, standing, check your joints for you, then let you know how I can help you further.
Yeah, sure.
All right.
No problem.
Okay, so any pain when I do this?
No.
Okay. Just gonna check a few more things. Is there any pain when I do this?
No.
So when we look at walking, we look from the hips all the way down to the heel. Ideally, we want it to be a straight line as much as possible. So a few things you can see. First one is that your knees are very close to each other. You have a little bit of knock knees. The other issue that is happening is that your feet are quite flat. So meaning the arches are lowered throughout. Okay, and then the feet tend to turn outwards when you walk. Okay, so for your condition, you'll benefit from wearing a bit of insoles just to support the arches. Okay, and then you may also need some physiotherapy to help you. Okay, so I'm going to fit you your insoles first. All right, and get you to step on this for me. So make sure your heel is sitting nicely to the back. Okay, make sure you will feel a little bit of pressure around the arch area. It should be comfortable, it should not be painful. Okay, so with that, I'll get you to wear the insoles and I also get my colleague Cindy in to have a look for the physiotherapy part. Alright.
Hello, I'm Cindy, nice to meet you. So first one that I'm gonna do is I'll get you to try and stand on one leg and just do a mini bend for me, okay? Do it slowly. And up one more time and relax. Okay, a bit shaky there, yeah? Okay. Now I'm gonna get you to come over to the bed, okay? And then we're gonna check your muscle strength around the buttock area. Sure. So I'm gonna drop it down and then I'll just give you a bit of support. You try and lift up on your own now.
I should try.
Yeah. We'll bring you outside to go through some of the exercises to help you to strengthen up the hip muscles.
Okay, sure.
Okay? The first one that I'm going to show you to do is teaching you how to activate the intrinsic muscles of the foot that will help to lift up the arc of the foot to prevent you from over-rolling. Try and drop your left leg down below the step. Correct. And then bring it back up so that your hips are level. I'll need you to go back home and do your home exercises. If you happen to have any issues with your exercises, you can either give us a call or text us on the WhatsApp and then we'll get back to you. When patients leave the clinic with a smile on their face and telling me that I've made a positive change to their condition makes my job worthwhile.
A lot of people don't realize how important their feet is until they are in pain and they cannot walk. So the most rewarding part of my job is to get them pain-free so that they can walk and run and resume their daily activities.